If you have been diagnosed with breast cancer, your doctor may want to perform a sentinel lymph node biopsy.
There are 3 reasons to check lymph nodes for any cancer, but for breast cancer, the reasons are to stage the patient appropriately so we can predict survival and outcome. The second reason then is to determine treatment based on that stage of a patient. And the third reason is to remove cancer cells and decrease the amount of tumor by actually physically removing the lymph nodes that may harbor tumor cells.
Our body contains 2 separate systems for transporting fluids, the circulatory system and the lymphatic system. The more familiar circulatory system transports blood. The lymphatic system is composed of lymphatic vessels and lymph nodes, which are collections of grape-like structures. The lymphatic system transports lymph, a colorless fluid, and lymphocytes, specialized cells of the immune system. Like small streams merging to form a river, small lymph ducts merge into increasingly larger lymph vessels that ultimately empty into the bloodstream. The lymphatic system serves many purposes, including the filtration of foreign objects like bacteria, fluid transport, and the initiation of the immune response. The lymphatic system is also where cancer cells can drain, collect, and gain access to other parts of the body.
Lymphatic fluid actually bathes the breast and then drains through lymphatic channels, much as rivers would drain into a larger body of water. So these channels then drain into 1 or 2 or 3 or 4 lymph nodes, and with certain dye injecting techniques, we're able to identify those important drainage lymph nodes. And the theory behind sentinel lymph node is if we check those first and they do not harbor any tumor, if there's no tumor in those lymph nodes, then we don't have to remove more lymph nodes in that particular patient. The technique of sentinel lymph node mapping involves injecting a dye, and one can either use 2 different types of dye, a radioactive dye called technetium sulfur colloid, and or a blue dye called isosulfame blue or methylene blue. Now it's very appropriate to use 1 or 2 or both. It just depends on that particular surgeon's training and abilities to find the sentinel lymph node.
In the blue dye technique, a small amount of blue dye is injected into the breast near the tumor. The dye spreads rapidly through the region. After 5 to 10 minutes, it will have traveled to the lymphatic vessels in the area. A blue-stained vessel is found and followed until the lymph nodes are reached. The blue-stained nodes closest to the tumor are the sentinel nodes. The sentinel nodes are then removed and examined for the presence of cancerous cells. In the radioactive colloid technique, a small amount of radioactive material is injected into the breast 4 to 6 hours before surgery. After sufficient time has elapsed, a surgeon uses a special handheld detector to identify the areas emitting high levels of radiation. These areas contain lymph nodes that have taken up larger amounts of the radioactive material. These nodes with high levels of radiation are called hot nodes.
And sometimes that is done the day before or the day of surgery, so the patient would have to come in the day before perhaps and get that injection, which would be injected around the tumor or around the nipple areolar complex. The amount of radioactive dye that we use for this procedure is very minimal, and it's quite safe to be around other people and being around your children, traveling in your car, on the bus, and be next to people. It's very similar to the amount used in a bone scan. In the operating room, after we identify the lymph nodes and remove them, some surgeons will send them right away to pathology to examine by a frozen section to see if there are tumor cells in those lymph nodes, because if there are tumor cells in the lymph nodes, then again, some surgeons that same day will go ahead and perform a complete axillary lymph node dissection in order to determine whether there are other lymph nodes involved in that particular patient.
The side effects of sentinel lymph node biopsy are usually limited to tenderness around the area of surgery that should subside with time. Other more serious side effects that can occur include numbness, limited range of motion, infection, and lymphedema. These side effects are less common, but they may occur and can have lasting implications on your daily life. For more information on breast cancer, please go to www.cancerquest.org.